telemedicine does have its advantages. Certainly if a patient is stable with regards to their disease, and if it's just like a check-in or a refill of their prescriptions, it's a great modality to exercise. I sort of divide it into two categories. If their PSA is well controlled, they're doing well on the medications that they're on, telemedicine is great for like a check-in or like a check-in for refills, a check-in for, just doing blood work that they might need. So it's really a great tool. The second category is, if for some reason, their psoriatic arthritis is active or they're having an active flare, they can sort of schedule a telemedicine appointment. And that does allow us, for the most part, just based on questions, seeing their joints in good lighting. Certainly we can't touch their joints to feel whether they're tender or swollen, but just asking them questions about stiffness, whether they're able to do the activities of daily living. I ask my patients to squeeze their hand, and I'm like, if you do that, does it hurt? And if the answer to that is yes, it sort of clues me in that there is some inflammation or tenderness that's going on. In that case, we can change their therapies and we can do it sooner rather than having a patient wait for an in-person visit, which can be cumbersome. Certainly patients, if they have active psoriatic arthritis, might find it harder to commute to see a physician just because of the pain from their active inflammation. While telemedicine has great advantages, I think the biggest challenge can be if there is a new patient who's seeing a provider for the first time. That scenario, it can have its limitations, which is, just sort of doing a thorough joint exam is going to be impossible on a telemedicine interface. So I can see that being a sort of challenging situation. And certainly, modern technology has made accessibility to your provider, especially for patients that have chronic medical conditions like psoriatic arthritis, very easy to do.